Okay, so our title for our evidence-based practice research paper is Effects of Sensory Stimulation on Hand Hygiene Compliance in Reducing Hospital-Acquired Infections. I'm Nicole Holtgrave.
I'm Nikko Cabrera.
My name is Nathan Lee.
My name is Nicole.
I'm Christine Lee.
And I'm Natalie Gerstner.
So as nursing students and future healthcare professionals, we understand the importance of hand hygiene because hand hygiene is the most effective way to prevent hospital-associated infections. But how often do we think about families and visitors needing to be hand hygiene compliant? As we began our research, we found an article that described how visitors can carry certain pathogenic organisms on their hands, and if they do not practice hand hygiene upon entry into a patient's room, vulnerable populations such as ICU patients may be at increased risk for not only infection, but life-threatening infections such as MRSA and pneumonia, to name a couple. Despite the fact that alcohol-based hand sanitizers is now readily available throughout most hospitals, its use among visitors is rarely evaluated or enforced. This prompted us to form our PICO question. In the hospital setting, does providing olfactory and visual cues effective in improving visitors' hand hygiene compliance compared to having no olfactory or visual cues to reduce the risk of hospital-associated infections?
In the evidence synthesis of our project, it was assumed that hand hygiene compliance amongst visitors under the scope of the 3 articles that we found were indicative of any individual who utilized any of the following devices. That's 1 hand sanitizer dispenser, hand rub dispenser, or a hand gel dispenser. Hand hygiene compliance was measured in settings of the pediatric ward, outside patient rooms, and the surgical intensive care unit, all that which fall under the umbrella of our project, hospital settings. Various methods of collecting data were used in all studies, some with direct observers and others via electronically triggered sensors. The findings and results emphasize the idea that hand hygiene compliance relied heavily and simply on the sensory stimuli being present to begin with in the first place. The theoretical framework of Adjen's theory described that planned behavior is driven by the intention to perform the action, where intention is later discussed to be heavily influenced by attitude, subjective norms, and perceived behavior control. In order to measure and collect data, 2 of the articles use measurement tools of direct observation, with the final article utilizing a technological feedback data collection method. Overall, it was important to consider emphasizing and manipulating the olfactory and visual stimuli from our project, the main focuses of the proposed intervention, to incorporate characteristics that would strengthen one's intention to perform hand hygiene.
According to the evidence grading system provided by Hauser, there's various levels of credibility when grading and critiquing research. With that scale in mind, the articles used to develop our protocol were various levels of 1, 2, and 3 articles. That means that they were either randomized control trials or quasi-experimental studies. Altogether, they were graded various levels of reliable and valid, according to their study methods, collection methods, and sample sizes. With this research in mind, we developed a protocol to implement, that being multi-sensory cues will be implemented to remind visitors to engage in hand hygiene. Those implementations and sensory cues will be olfactory and visual cues.
This project can be more effective from the participation of both visitors and hospital staff. With the knowledge obtained from training, a new system can be implemented and encouraged by not only the nurses and doctors, but by all ancillary staff as well, such as receptionists, janitors, and aides. This can ensure staff can implement protocol when there are failure systems. When the patient's health is a top priority, it should be required to reduce transmission of hospital-acquired infections. The impact of using visual and olfactory stimuli to increase hand hygiene compliance in visitors represents a significant subpopulation in a hospital or healthcare facility, and can potentially have a big impact at a relatively small price tag. Adding visual stimuli to hand sanitizer dispensers can range from being extremely cheap by using static images to moderate overhead costs for dynamic display monitors. As for olfactory stimuli, commercial automatic air refreshers are very cheap and are already commonly found in hospital bathrooms. Overall, the implementation of our intervention can be adjusted depending on the facility budget. This makes our recommendation highly flexible while still maintaining a consistent level of effectiveness.
So to implement the multi-sensory cues, we would add olfactory and visual add-ons to the hand sanitizer dispensers. So when the visitor enters the room, the hand sanitizer will have a motion detector inside, which will go off, and an olfactory cue will be released. The olfactory cue we chose to use was a citrus scent, which would remind the patient to hand hygiene. The next cue that we had was a visual cue. So along with the olfactory scent, there would be a small monitor on the actual dispenser, and that dispenser would then show an emoticon, either a frowning face or a smiling face. So when the patient enters, there will be a frowning face displayed for 25 seconds or until the hand sanitizer dispenses and the visitor does their hand hygiene. Once that happens, it will change to a smiley face, telling the visitor that and reinforcing that they've done their hand hygiene and adding more positive feedback to their hand hygiene.
So in order to evaluate the interventions, we would utilize our motion sensors. One, when they enter the room, that would keep track of the hand hygiene opportunities. And then secondly, on the display, there would be, when it changes from a smiley face or a sad face to a smiley face, that would indicate a successful hand hygiene event. And then you would express that as a fraction to get a percentage of frequency of hand hygiene observed. So that would be our first outcome measured, frequency of hand hygiene observed. And then secondly, we would look at the decrease in hospital-acquired infections. That's unfortunately a much more long-term scope, so that wouldn't be something that we'd be able to measure in a short period of time. And that's how we would evaluate our interventions. In terms of recommendations for practices, we would utilize our interventions that we're implementing as a tool. No intervention is going to be perfect and make hand hygiene compliance 100%. It will increase it, but we can use this as a tool. So when somebody enters the room and then they notice that the healthcare provider notices that they have not utilized the hand sanitizer dispenser, then they can know that it's an opportunity to educate these patients that are being non-compliant and explain to them how using this hand sanitizer dispenser, which is a very simple, effective measure, can decrease hospital-acquired infections significantly. Thank you.
And don't forget, wash your hands. Okay.